So Trent wanted me to mention exactly what it is that we do with the voice recognition systems. My name is Dr. Lagos. I work with one of the allergy offices here. We've been using voice recognition for about 7 months, actually for about a year now. And from our standpoint, we think that the voice recognition has definitely been helpful because it has allowed us to compensate where the electronic records have basically slowed us down. From our standpoint, we think that the paper chart is still a much better method. Not really necessarily better, but an easier method for us to use because that's what we've always been trained to do. But the voice recognition, as I mentioned, has definitely been helpful in allowing us to become more productive overall. And as you can see on the initial picture there, that you could see different contexts with which the computer was trying to figure out my voice. And it basically compensates for my accent. It compensates for the way that I actually talk. And it often will clump the words in 3 to 4 letter chunks of a sentence to figure out what it is I want to say overall. But I think one of the things that is difficult is that it will sometimes put the wrong word in where you, when you actually dictate the word. So sometimes it will substitute the word penis for the word peanuts. So that's where you have to try and figure out, and you have to actually go back and read your actual notes overall. But otherwise, you can come up and look at the actual screen here, and you can figure out exactly what it is I'm talking about. Let me just erase this completely from the beginning. And you'll see that as I start to dictate, it starts putting the words up on the top part of the screen and is trying to figure out the context with which the words are being used. So for example, dot patient start. Now this is something that we can use as a shortcut, and it will go ahead and put in the patient's name as far as age and so forth. And you'll see now that it's going to start putting words up in the top and then throwing them down into the paragraph. Presents for an interval visit and reports that pulmonary symptoms have been present for 5 years and have gradually been worsening, period. Now, one of the things you also have to realize is that sometimes if you tend to run your words together, it will have a hard time separating exactly what the words are. And to prevent that, you need to be a little bit more directed and focused with how you pronunciate your words and exactly what it is you're saying. If you use a lot of jargon, it will have trouble. Now, this is using the speech recognition software of Dragon, and the Dragon is something that can be picked up for just casual layman terms, but can also be used for medical jargon as well as that used for lawyers and so forth. So there are different programs available. Now this is a program that is using this microphone, but you can also use headless phones for this also.